Going to the ER isn't fun for patients, and it's certainly not the cheapest way to deliver medical care. So a group of paramedics and EMTs who normally transport patients to hospitals in Lee County are doing something different. They're making house calls with the goal of reducing visits to the ER. Joining us to explain how this new program works is Lee County's Public Safety Medical Director, Dr. Jim Augustine. Dr. Augustine, welcome.
It's a pleasure to be here. Thank you.
So I find this program fascinating. Why give paramedics, EMTs these new duties? How is this going to help?
This helps the community by delivering care to people who need care in something other than the back of an ambulance, an emergency department, or an urgent care center. And for our paramedics and EMTs who work on the streets, this is a way of them delivering much better care than they can deliver by one time after another coming to see somebody with red lights and sirens on.
So let's talk about the patients you're really focusing on.
Okay. We started this program as a pilot about 8 months ago with some of our opiate recovery funds for the state in an attempt to reduce the number of overdoses and fatalities and people with issues that would lead them to overdose in the field.
So that case you were talking about was the settlement with the pharmaceutical?
It was the opiate
pharmacies.
settlement funds that came into the state of Florida, and they were funding programs like ours across the state. And those programs have come to reduce the number of overdose deaths, and the people who have those recurrent situations found a much better way of caring for those people. We're implementing the programs that have been implemented in other parts of the state and the country that reduce that impact on our community.
So you identify a patient who, let's say, has dealt with some overdose issues various times. How do you help them? What does that visit look like? Yeah,
oftentimes in the past, these people would have simply been continuing to do their drugs. Their friends find them unresponsive. They call 911. Our crews come, deliver life-saving care, sometimes with naloxone in the nose. And then oftentimes that patient will refuse further services, or we wake them up and take them to the emergency department. They get instructions, they get attempts at care, but a lot of times they don't do a really good job of following up.
Right.
Instead, with this program, we are able to call our own internal people, a staff of full-time trained paramedics and EMTs who are used to dealing with these issues. They go find that person, whether they live in a house or an apartment or on the streets or in an encampment. We find those people and offer them different services. Oftentimes doing it on their terms results in a better outcome for them because we can find treatment for them that matches the needs that they have and the weaknesses that we have found in the system here. So they can get them on treatment in the field and then never have them have to go back to the emergency department or their friends calling 911 again.
And there's a wide variety of patients that you're really targeting. You mentioned to me earlier, maybe seniors who've had hip fractures, cardiac patients. Tell me about those.
Yeah, so the program, we have an opportunity now in partnership with Lee Health to expand this program and to deliver care to people who are identified at the hospital level as having needs that may not be well met by them simply going home and having an occasional visiting nurse come to see them. Those patients, the hospital can call us, let us know those patients are going home, that they're frail, that they have needs that may not be matched well again by having them coming back in the emergency department or having an attempt at having physical therapy or other services at home. We send a crew to the house, figure out what their needs are, begin to address those needs at home. In some cases, getting them aligned with palliative care or hospice. In some cases, finding better home health care services that match their needs. And we can do that across our entire community, which sometimes isn't easy for the hospital-based care to do.
I assume you would argue this makes financial sense and that there's proof that this type of program works, right?
Yes, and actually the experience from both across the country and the experience I've had in other cities, this makes financial sense by reducing the number of patients in our medic units, reducing the number of patients going to the emergency department, and keeping these people's bills from getting higher and higher when they're already identified as having problems related to their heart or their diabetes or their hypertension or their COPD.
Because in the end, if they're indigent patients, right, that bill sort of comes back to the community in many ways.
Yes, it does, but many of these patients have some insurance,
Okay.
but that's still a cost to everybody in the system. When those patients can't find the right care, and of course we have a certain burden here in this area because we have a lot of visitors who are only here part-time. Sometimes they come down here not so healthy, and they try to think that Florida sunshine alone will get them better, and they begin to have their problems, and then they're back in the emergency department again and back to their hotel or home. We are like shortcutting that by saying, if we've identified that they need care, we know the system really well. We have EMTs and paramedics who know the system really well. Let's find them the right care and keep them in their home, keep them in their hotel, keep them plugged into the system at the best site of care for the least cost.
You say that you've seen it work in other communities,
Yes.
right? And how do you think we will all benefit?
Yeah, we all benefit when patients who are getting health care get it at the right place, at the right time, with the right service, at the lowest possible cost, with the satisfaction of the patient in mind. And in cities like Washington, D.C., where I've served before, we had this program which was very successful in getting patients linked with the services that they really needed and not wait for another crisis to occur for them to be back in the emergency department or in an inpatient bed in the hospital.
And just to be clear, it's not just paramedics and EMTs doing this hard work. You've got a team working together on this.
A growing team of people with varying skills, including social services, including mental health workers, including palliative care workers. We can bring that whole team to play to serve patients.
All right, we would love to have you back to see how the program has success in the future.
And I would love to do that. Thank you.
Dr. Augustine, thank you so much for your time.
A pleasure.
Thanks for watching. We've got more great content for you, from news to the arts to the environment. So be sure to like and subscribe to WGCU's YouTube channel and follow us on our social media platforms for the stories that matter to you.